I'd start by identifying key findings on this chest x-ray. I'm immediately drawn to the large area of airspace opacification in the left lung, predominantly in the left lower lobe, with some involvement of the lingula, given the obscuration of the left heart border. The presence of air bronchograms within this opacity suggests that this is a consolidation rather than a mass. Notably, the rest of the lungs and the mediastinum appear unremarkable. No hilar enlargement or pleural effusion, which helps narrow down the differential diagnosis. Given the appearance, the clinical context is vital. If the patient presents with symptoms of an acute respiratory infection, the most likely diagnosis here is a lobar pneumonia, particularly of the left lower lobe. The absence of any signs of volume loss, such as mediastinal shift or elevation of the left hemidiaphragm, makes an atelectasis less likely. However, even though pneumonia is the front runner, I'd keep in mind that opacifications like this could also represent less common entities like pulmonary infarction, given the wedge-shaped appearance of the consolidation, or potentially a malignancy, especially if there are risk factors such as smoking or weight loss. This leads me to recommend follow-up imaging after appropriate treatment to ensure resolution, particularly because failing to do so could result in missing a possible underlying malignancy. For further investigations, a repeat chest x-ray in 6 weeks is crucial to confirm resolution of the consolidation. If the opacity persists or there is clinical suspicion of an alternative diagnosis, a CT chest would be the next logical step to better characterize the lesion and assess for any underlying mass or lymphadenopathy. Now, let's anticipate some questions the examiner might throw my way. 1. What if the patient is a smoker with a history of weight loss? In this case, while pneumonia might still be the working diagnosis, I'd have a lower threshold to consider an underlying malignancy. I'd emphasize the importance of follow-up imaging and potentially suggest an earlier CT scan rather than waiting for X-ray resolution. 2. What features on a CT scan would help you differentiate between pneumonia and a mass? On CT, a pneumonia would typically present as a consolidation with air bronchograms and may have associated pleural effusion. A mass, on the other hand, might show more nodular features, irregular or spiculated margins, and potentially associated lymphadenopathy. 3. If this was a pulmonary infarct, what additional findings might you expect? A pulmonary infarct could present with a peripheral, wedge-shaped consolidation. I'd look for signs of pulmonary embolism, such as filling defects in the pulmonary arteries on a CT pulmonary angiogram, or pleural-based consolidation with the characteristic Hampton's hump. Lastly, don't forget to subscribe, comment, and share our Radiology Made Easy YouTube channel for more tips and tricks on mastering your radiology exams.